Okay, so we're going to talk about shoulder rehab and some differences with them versus lower extremity injuries. So, we still have our 5 stages of rehab. They're a little bit different. So for shoulder rehab, our first stage is range of motion and price. Okay, so protection, rest, ice, compression, and elevation, and some gentle range of motion. Stage 2 is our strengthening phase. Stage 3 is, normally it's balance, but with this it's proprioception. Okay? So proprioception is about hand-eye coordination. Stage 4, normally would be plyometrics, and it's kind of the same with our shoulder, but it's a little bit different. It's more about throwing and catching. So, we do that, catching. Also, unexpected reactions. So we're going to use a lot of ball stuff. To create those unexpected reactions, throwing, catching, single head, two hand, overhead, hand, underhand, things like that. And then stage 5 is sport specific or functional exercises. So those are the stages we'll go through. We'll go into a little bit more detail of each one of those. So let's talk about stage 1 here, range of motion and price. So this is kind of the biggest one with our shoulder. We start out with different progressions. So first off, what I want to think about is we're going to start out with range of motion. We're going to start out with passive range of motion. Okay, so passive range of motion progresses to active assisted range of motion, which then is going to progress to active range of motion. And then the final one is resisted range of motion. So those are the abbreviations we use for the different ranges of motion. And we can use the same exercise in each of these phases. So passive range of motion, active assisted, active, and even resisted range of motion. So the first thing we can do is shoulder mobilizations. This is moving the shoulder joint for the patient so we don't get frozen shoulder. This is kind of shifting it back and forth, up and down, things like that to work on shoulder mobilizations. The next one we can do is what we call Codmans or pendulum exercises. And what these are is these are moving the arm in a relaxed manner, especially with passive range of motion or even active assisted, in these different movements similar to like what a pendulum does on a grandfather clock. So we can start out with just front and back, and then go side to side, and we're just lean over a little bit. As we get better, we're going to lean over more, get bigger range of motion, front and back. And then we can start doing circles, clockwise, counterclockwise, starting out small, and then going bigger with these. We can do this for 3 sets of 30 seconds. We can do it for a minute. We can start adding resistance where you have to hold a dumbbell and some weight with it. So those are all pendulum exercises we can do for that. So call it pendulums and arm circles. So they're all down low. As far as active assisted range of motion, there's some other things we can do to kind of help with this. So some tools we can use. As we get to more range of motion, we can do things called like spider walks up the wall, where essentially we're using our other arm, help climb up the wall to start getting more elevation with it. We can also use a towel to help us stretch. So if we need to stretch this arm maybe into internal rotation. So kind of like that, we're going to pull this arm up. Or say it's my other arm and I want to pull it down into more external rotation. So we can use that towel. We can also use a wooden dowel to do the same thing for it. Lots of different things we can do for it. So we can also use a pulley if we have it. So a pulley with a rope on it, we can essentially pull it one arm up, one arm down, and we attach it up high. I don't have one to show you, but we can do that. Or we can do doorway stretches. And doorway stretches are using a doorway, and we can do a few different exercises with them. The first one, if this is a doorway, kind of hold the door jamb. We pull it down like this, start getting extension. We can put our arm in the door jamb, start getting external rotation. We can go the other way on this side and getting horizontal adduction. And then the last one we do is we stand in the doorway with our arm like this, 90 degrees, and we start pulling this back. So all these different things we can do for it. So we can do towel stretches. We can do dowel stretches. We can do spider walks up the wall. We can do doorway stretches. A bunch of things to help and assist with range of motion to get more range of motion with that. As we move on, we get into strengthening exercises as well. So this is so the same exercise we can do as active range of motion. We can also do with resisted range of motion. Okay, stage 2. So stage 2 is strengthening. So the progression with strengthening exercises as well is we start out with isometrics, and then we're going to go to more active movement stuff. So isometrics, when we do that, we are just pushing against something. And this could be pushing against the doorway, it could be pushing against the wall, different ones. So we can do elevation, pulling up against something, pulling down, internal, external rotation where it doesn't move. Okay, so we can do push-ups against the wall. So we can do internal rotation, external rotation, elevation, adduction, abduction. So lots of different ones we can do with that. Also wall push-ups. Okay. That essentially is going to be holding a position against the wall, maybe in a different position, maybe like this, 30 seconds like this, 30 seconds with the arm straight. So different ones we can do for that. And then some stability exercises. So stability exercises are ones where we help to kind of strengthen the arm and do it. And one of the funnest ones to do for patients, they lay on their back, they hold their arm up in the air like this, and then I move it back and forth and try to get them to hold and not let it move and hold it in position. So I'll use my hand, try to keep it from going all different directions as that shoulder joint is helping to stabilize that and hold it in place. It's supposed to be an isometric exercise, but it does move a little bit, so we want to wait until they're pain-free to be able to do that. Then we can start adding some other stuff. So we can start creating a little bit more movement or isotonic movement exercises. Okay, so isotonic exercises are eccentric and concentric exercises. We can do pendulums, keep it easy, down low. With dumbbells, add some weight to it. We can do arm raises with or without resistance, so we can just do it with no resistance. We can do exercise band, or we can do dumbbells, things like that. So with or without resistance. We also use exercise bands or TheraBands, as well as strength training, push-ups, things like that. So exercise bands And then strength training. This could be with weights, it could be body weight. Such as push-ups, pull-ups, things like that if they can do it. So those are some basic ideas for strength. There's a lot more we can do. We're going to use a lot of exercise band work. We're going to use a lot of dumbbell work. Fairly basic, fairly easy with strengthening exercises. All right, stage 3. We don't do balance for the arm, but we do proprioception. Okay, so proprioception is that ability to control our body in space, which is really important for our arm. So with proprioception, there's different things we can do. We can do things on our own. We can do it with a partner, mix it up. Some of the funnest things to do is ball toss. So if we do a ball toss, it can be with ourselves. You can do that against the wall. We can do it against a tramp. We can just do it on the floor. Things like that. Just get it fairly basic. And then we can do partner ball toss. So maybe they're going to start tossing it a little bit different. Maybe they're going to bounce off the floor. They're going to toss it out to the side. We have to catch it. We have to react to it. Things like that. And then we can also do it against the mini tramp. So once that happens, now we don't really know exactly where it's going to go. We have a general idea, but depending on how they toss it. So they're going to throw it against the tramp. It's going to come back. They're going to have to catch it. It's going to have a little bit more reaction to it. So those are all fun things to do with the ball toss. We can do it with a regular ball, like a tennis ball. We can do it with a weighted medicine ball. We can do it with a heavy, bigger medicine ball. So lots of different progressions we can do with the ball toss. We can also do unstable surfaces. We can use RX pad. We can do a Bosu ball. And what we can do with that is we can do like push-up type positions. We can do it on a table where we have the RX pad and they have to try to keep their stability, their balance in their arm as they stabilize on the table, but on that RX pad or at an angle. It's kind of like a plank push-up. We do the Bosu ball where we could do it with flat side down. Okay. Or we could do it with flat side up, much more unstable. So flat side down, put your hands on it, try to stabilize it. Maybe we go into a plank position or a push-up position with it. If we do flat side up, now we're going to get a lot more movement and stability with that Bosu ball in the same type of position, planks, push-ups, those type of things. We can do this as well, progressing from 2 arms to 1 arm. Now obviously some of these things may be a little too difficult to do with 1 arm, but a lot of them we can. The RX pad, the Bosu ball with the flat side down, we can do 1 arm as we get enough strength and enough stability in that. And then the last thing we can do is partner reaction drills. So this can be with ball toss, we can use a reaction ball, we can do lots of different things. We don't really know where we're going to do. We might incorporate even some balance where they're standing on an unstable surface and then having to catch the ball in weird positions where they're not expecting it. Or we can do it where we're standing behind them and we're going to bounce the ball off the wall. Maybe patient's going to stand here, they're going to stand behind them, and they're going to toss the ball and I have to react. I don't know where it's going to come from. So we can do different things like that to create reaction drills for them and help with that proprioception. All right, so stage 4, usually for lower body stuff would be plyometrics.